ARC East Midlands short course training programme. Thank you for joining us. I'm delighted to introduce Professor Justin Waring, who's delivering today's Evaluation Skills and Approaches session. Justin is Professor of Medical Sociology and Healthcare Organisation at the Health Service Management Centre, University of Birmingham, and Director of the Brace Rapid Evaluation Centre. He's also Fellow of the Academy of Social Sciences and Royal Society of Arts. Justin has extensive research leadership experience in a number of high-profile agenda areas, including patient safety and organisational learning, quality assurance and risk management, and major systems change. I could go on telling you things about Justin for the rest of the hour and his success, but I'll hand over to him any second now, just to say there'll be an opportunity for some questions at the end. If you'd like to put those in the chat, I can read them to Justin at the end. So thank you very much for joining us, and I hope you enjoy the session. And also, could I ask people to turn their cameras off, please? Thank you very much.
Thank you, Rob. Good afternoon, everybody. I'm hoping you could all see and hear me. I'm confronted with a screen full of circles and initials, so hopefully it's a bit daunting from my perspective. What I'm going to do is do a slide share, and hopefully you'll be able to see what I'm going to be talking through. I'm useless at this stuff, so bear with me. Presenter mode, for goodness sake. Window. No. Why is it not sharing content? Bear with me. Okay. It's asking now for security and privacy settings to be updated. Sorry about this.
Would you like me to share, Justin, as long as you don't mind saying next slide every few seconds?
Please, Rob. I'm on a Mac, and Macs are useless on MS Teams as well, so that would be better. If you could.
Can everyone see that?
I can.
Yes. Yes,
brilliant. Thank you.
Thanks.
So just next slide whenever. Thank you.
Yeah, thanks, Rob. So I want to say apologies for the technological hitch. And thank you for Rob, Emma and the ARC team for inviting me to speak with you today about evaluation skills. I am a long-term collaborator with the ARC in the East Midlands and worked in the predecessor, the Clark, and know many of the team over there very well and used to work with Rob. What I want to talk about today is less about the specific skills of doing an evaluation technique or approach, such as how we might do a discrete choice evaluation.
Actually, I'm quite an ideas person, so actually having people who have an eye for detail is.
So rather than wanting to do a focus on particular skills of doing a technique or a method, for example, what I want to do is think more broadly about what are the skills and approaches for designing and configuring an evaluation overall, and thinking what are the distinct set of things that we need to take into account when we're doing evaluations, and what different skills and approaches we need to do that. I'm going to draw on my experiences from when I was based at Nottingham in the East Midlands, when we did evaluation work as a part of CHIL, but also more recently my experiences in leading the NIHR Birmingham, Rand and Cambridge Rapid Evaluation Centre, which is one of 5 NIHR funded centres to carry out rapid evaluations of promising service innovations. I'm not going to talk in detail about any specific evaluation that we're doing in Brace, rather I'm just going to draw from those experiences to talk about the overarching kind of skills and approaches that I think are really useful when we're thinking about evaluating something. And I'm going to be talking about 3 kind of broad sets of things. So first, kind of the principles that I think are really important. Second, the kind of overarching process that an evaluation might take. And then third, the specific considerations that go within kind of that process. Next slide, please, Rob. So to start us off, it's worthwhile thinking, well, why do we want to evaluate, and how is evaluation different from research, for example? And what we kind of might need to think about is that evaluations are often about trying to work out what's worked and why does it work. And I'll say a little bit more of that in a second. But to put it in context, is that we know that health and care services are under enormous pressure. They've got to meet funding problems and underfunding. They've got to deliver more quality care, safer care, more integrated patient or person-centered care. And doing all of this involves innovating, doing new things, trying out new things. And this is great. I mean, I think that the health service is a really good example of a really thriving community of people trying to do things better all the time. And that kind of innovation, can be really good, but we need to know, does it work and how does it work? Are we letting the right people know that these things are working, or if they don't work, we shouldn't be doing them and other people shouldn't be doing them? So evaluations are about working, providing answers to these questions about, does this work and how does it work? Next slide, please, Rob. So these are the kind of three key questions that we might often talk about. So does it work? And I've put in brackets here and there, because actually there's often differences. What might work for one organisation might not work for another. So there's an issue there about, does it work? But the other questions that come through is, how does it work? So how does that innovation or that intervention or that new way of working work here, but not there? And then the related question for that, which is really important for when you're thinking about should other people do this, is why does it work? So it's trying to explain, does it work, how does it work, and why does it work, are some of the kind of three core questions that we think underpin evaluations. In many ways, and I'm not going to go into lots of detail about this, evaluation is a type of research, but it is often distinct from more other forms of kind of health services research that might be, like, for example, randomized control trials or large longitudinal studies. I mean, in many ways they are evaluations, but when we think about service evaluations in particular, we're often looking at innovations that are already in place or in the process of being developed. And I'm only mentioning that because there are some quite strict guidelines for the purposes of research governance about whether something is classed as an evaluation or research. I won't say any more about that for now, though. Next slide, please, Rob. So what I'm doing is, like I said, I'm going to talk about the broad principles, outline the kind of the approach or a process that we've developed and worked up most recently in Brace. And then I'm going to talk about some of the specific considerations that need to be taken into account. Next slide, please, Rob. So, yeah, like I said, why evaluate? And it's not just in health services that we need to do evaluations. We often need to do it in what we call time critical situations, when things are happening in real time, and we need to think about what is working right now and what is not working right now. And so the pandemic was a really good example of where that happens, but you see in other disaster zones and in other settings. And I suppose one of the things that I'm kind of coming to the conclusion of is that in healthcare, we're kind of almost living in permanent disaster zone. We're almost always up against it in terms of trying to find out new ways of dealing with a problem, how to resolve it, and constantly asking people to experiment with new ways of working or to introduce new technologies or therapies or whatever. And does this actually work? Next slide, please, Rob. So these are the kind of four principles, and I've put rapid there in brackets, because I think actually these are probably four principles that need to be borne in mind for all types of evaluation, but these are particularly important for rapid evaluation. So I'll go through these one at a time. So rapidity, rigor, relevance, and responsiveness. And I didn't coin these at all. There's a huge literature in evaluation science that develops each of these dimensions and provides some really good insight. Next slide. So why rapid, and what makes evaluations rapid? And I think this is something that we in Birmingham and RAND in Cambridge particularly specialise in. And this is about delivering these time critical answers to really important pressing questions and problems. And it often deals with producing answers, yeah, like I said, more quickly. And you can do this in various different ways. So one way might be around changing the pace at which you do an evaluation. So you might simply say, right, we need an answer within 6 months. How do we accelerate the pace? Do we get going more quickly? Do we change the way in which we're going to collect data collection? Do we accelerate our reporting channels? So you might look there to think about how to deliver answers and evaluations quickly by compressing the time. You might also think much more pragmatically about the scope of your evaluation. So, for example, if you're wanting to evaluate a new discharge pathway, and you might think, well, actually, we might want to, think about, if we want quicker answers, focusing on those areas that we've got a real problem in. So you focus not on all the areas that might be doing it within a trust or within even an integrated care system, but actually on a number of small pockets of focal interest. And the point is, it's about actually trying to deliver the key lessons and evidence on time. You might want to think about adapting methods and thinking about how you interpret and analyze results. But the key point here really is that evaluations often need to be about doing things more quickly than longer pieces of research. So that's one of the key things that we have to bear in mind. Next slide, please. So how do we think about doing evaluations quickly? And there's a number of different ways in which you can do this, and some of these will elaborate when I talk more about the processes rather than the principles. So some of the key things is having the ability to deploy your evaluations quickly. So having a team of trained and experienced evaluators is really important for health and care organisations, or having collaborations with other groups that can do this. But the idea of designing and deploying evaluations is a really key feature. The second is around spending a lot of time on scoping out and specifying exactly what an evaluation is trying to do, so it delivers the right answer. Like I say, I'll come on to this in a bit more detail shortly. It's also really important with all evaluations to be really realistic about what can be delivered, what's feasible and what's desirable, and what is kind of practically going to be possible. So thinking about those issues in the design stage is really important. A link to this is about being pragmatic. You've got to think about how much information is enough for this evaluation or this piece of work. So it might be that you want to know, does it work in a very discrete way? Well, then think very precisely about the information or data you're going to collect, and trying to shield yourself off from having too much information, which can be noise rather than signal. And so often what you find with evaluations is the need to balance breadth with depth. So you have to be very focused and think about either fewer things that you want to look at in more depth, or you might want to look at more things but in more superficial ways, because it's that trade-off often with evaluations. Next slide, please. I think that this is really important for all evaluations. It's rigor. It's about making sure that the evaluation still adheres to the same types of methodological standards you would expect in other types of research. Just because it's an evaluation, it doesn't mean it has to be any different. And so we should really make sure that we use all of the relevant methodological standards and techniques that you would for any other piece of work. Because at the end of the day, the evidence that's produced from an evaluation has to be credible and seen as legitimate. So, it's evaluations aren't about cutting corners or aren't about kind of fudging data collection methods. Quite the contrary, they're actually about maintaining methodological standards. So always looking where possible for really robust measurements. Evaluations are often about actually, can we see an effect or change in something given the introduction of a new intervention or innovation? So actually some kind of before and after and control measurement is really important, which helps understand, does this work? But also understanding what's going on with the innovation or intervention is really important. So understanding the mechanics of what's going on. To help us do this, to really help think about rigor, we often talk about developing a theory of change. And a theory of change is really a kind of set of assumptions about how an innovation should work, almost a kind of A to B to C to D set of causal assumptions that if we do X, it will lead to B, it will lead to C. In the health and care world, we often see these in the form of things like logic models or input-output diagrams. But the importance of a theory of change is it really helps articulate the assumptions that an innovation is expected to have. And then you can start to put measures against those assumptions. So, for example, if it's about X number of staff to do a particular service or provide a particular service, then actually you can measure whether you've got those numbers of staff. We also think it's really important to draw upon the wider literature and relevant theories where they are to really bolster the findings of an evaluation. Evaluations are often case-based, so it's a given innovation in a given organisation setting. And so the question is, well, how generalisable is this? How rigorous can we say this case is in terms of speaking to the wider kind of issues facing a whole healthcare system? And that's where you can engage with the wider literature and evidence base to help develop and contextualise what you find from an individual evaluation. Next slide, please, Rob. So why is rigour important? And I've kind of alluded to some of these already, but it's really important for all evaluations to be rigorous so that stakeholders, decision makers, whoever they are, can have credibility and kind of understand that the evaluation is credible, and then they can act upon that evidence with confidence. And like I've said, it's really about kind of that sense of kind of generalization beyond the case. Okay, so this is happening at your hospital, but what might happen if we move it from your hospital to another hospital? Or, for example, what are the issues we need to take into account if we move it from the acute sector into the primary care sector? So evaluations might have the answers for one set of issues, but it can also generate the questions for another set of issues. Next slide, please, Rob. The third R in our sets of principles is about being relevant. And this is about making sure that evaluations actually are appropriate and acceptable to those key stakeholders, and they answer the questions that key stakeholders and decision makers care about. So there's no point, for example, devising an evaluation that might answer the questions that I might want to explore as an evaluator if actually we're being commissioned or contracted by a client. It's very much that kind of think about what your client or your partner or your collaborators really need in terms of their decision-making processes. So thinking about what is the evidence they need, but more than that, when do they need it by, and in what formats do they need it by? And it's also recognizing that not all stakeholders will have the same needs. So you will often have to meet the needs of multiple stakeholders around any innovation. So for example, it might be the service users, it might be professionals, it might be the commissioners, it might be regulators. They'll all want to see different things from the piece of evaluation that you'll be designing. So a really important part of any evaluation process is to think about who are your key stakeholders and how can you be relevant to what each of those expects or wants. Next slide. Now, I'll say a little bit more about this shortly, but some of the key ways in which we think about this is about co-designing and co-producing evaluations. And this reflects a broader kind of view in the health services research landscape that we see today, is that rather than doing research on people or to people, we should do it with people. And that service users in particular, but also professional groups and all relevant stakeholder groups should have a voice and an influence on how research and evaluation is carried out. And so co-design becomes really important for thinking about kind of the design and specification of an evaluation, making sure that the questions are right, that the process is going to be able to deliver on those questions, and that the dissemination process at the end is appropriate. And I'll say a little bit more about all of those different stages as we move forward. When we think about co-designing, we have to think about, for example, how it can help as well us think about accessing different groups, accessing different data sources, making sure that the learning gets out to people at the right time and in the right ways. Next slide. And the final set of principles that we kind of really adhere to is about being responsive, and this is links to kind of cross-cutting theme, but it's about being relevant. It's about being alert to the changing needs that people have. Like I said at the beginning, health and care services are in a constant kind of process of crisis or firefighting or change or innovation, and a lot of the time what we realise is that when we start an evaluation, actually midway through, our stakeholders will have changing priorities. Their expectations would have evolved. Some other catastrophe would have impacted upon them, and so evaluations have to be constantly alert and responsive to what's going on in the wider system. That might mean kind of evolving or changing an evaluation, or more broadly, just taking into account what these different factors are that might be impacting upon how an innovation is working. So it might be a part of the kind of contextual fabric in which change is happening. So you need to bear that in mind. And so a lot of this is about being pragmatic, being responsive, being alert to what people are dealing with, and that might involve having, for example, regular check-ins. Next slide. There's lots of kind of risks and kind of opportunities with evaluations, particularly the rapid evaluations that we often do, and this is often where it contrasts with kind of broader pieces of kind of trials or other kinds of research that people get involved with. And for the rapid evaluations that we do, there's question marks around about whether the findings are too superficial, whether there's the necessary depth of understanding, whether actually what we've just produced is a snapshot rather than a long-term picture of change. Are all relevant stakeholders and audiences always engaged in evaluation methodologies? And is it possible to always follow up and trace innovations as they evolve over time? And actually, one of the big issues that evaluations often struggle with is telling the social history of an innovation, where they come from, how they evolved, because often there's a 5 to 10 year kind of antecedent period before any kind of innovation is kind of developed and introduced. And often we're looking at small windows rather than the kind of the full life cycle. Next picture, next slide. So what I thought I'd do now is kind of, after setting out these kind of principles that we try and adhere to, is outline our model. And this is the BRACE model, and there's lots of other type of evaluation frameworks that you can follow. But I'm going to talk about this because it highlights not just our key stages, but some of the kind of the key skills and approaches that need to be borne in mind across an evaluation journey. So I was going to talk through all of these. Next slide. And this is a kind of stepwise approach. It can be followed like this, but it isn't linear. And it's often, like with any piece of work, evaluations have lots of false starts and going back and redoing things, and they're much more iterative and cyclical. Because, like I said, new things will emerge and you have to be attentive to these new things, and you might have to go back and change the design or rethink about what measures you're looking to collect or which stakeholders you need to engage. But the way I'm going to talk about it is as a kind of stepwise process. And in particular, these first 3 stages are, for me and for our team, the most important stages. Next slide. So scoping. We think this is really important for any piece of evaluation. And the saying that we often have in BRACE is that you don't scrimp on scoping. Now, scoping really is this early phase of what an evaluation involves. And to give an example, it might be that you're liaising with a client, it might be a service leader, a policymaker who've asked you to think about, you've developed this innovation, or we've developed this innovation, can you evaluate it? And it's at this stage that you enter into these quite detailed and really careful conversations that help us really clarify what it is the evaluation is trying to do. And so at this scoping stage, you're really trying to define the focus. That is, what is actually the innovation we're talking about? What is the intervention or the new way of working? What is it? And what evidence do you need to know about that innovation? You also want to know these critical things about what's the timescales, when and why do you need to know this evidence? So in one of our recent evaluations, we were asked to do a piece of work that coincided with the annual budgeting program, so the evidence could feed into annual budget planning around a particular service area. So we were very much tasked with delivering this evaluation on a particular date to inform these wider processes. But it might be other kind of commissioning or contracting windows that are really important for people. But really just being really clear about what's needed, about what and when, and defining the purpose of the evaluation is really important. And that might mean, the basic questions about, does this work, how does it work, and why? But there are secondary questions that people don't often talk about that we think are really important. And that is about what's the underlying agenda here? What are you trying to work towards? So you get an understanding of the different priorities that different groups might have and about evaluation. And that's really important for when you're thinking about how you prioritize the learning and the evidence and your communication strategies throughout the evaluation process. It's also really important to think about what we call evaluatability and feasibility. So not all innovations can actually be evaluated. They might be too early in their development. There might not be enough data about them. They might be just at very early stages, or they might be in the process of being decommissioned. So you might think actually that there's no worth in carrying out this evaluation at this stage. It might also be the case that evaluations have already been done on very similar innovations or interventions, and so you might think, well, why do another one when actually there's already really good robust evidence out there about how you evaluate something. So it might not need an evaluation. You might be able to draw upon other evidence. But the key thing at this scoping phase is about really being clear about what the client and stakeholders really want from the evaluation, getting that really tied down. And it's often about expectation management, so you don't overpromise or underdeliver. Next slide. So I mentioned previously about the importance of a theory of change, and we think this is really important when doing evaluations, because often people in health and care services have great ideas for improving how they work and where they work and improving patient experience. And some of these are evidence-based and some of them are almost made up on the job, kind of on the shop floor. And so, innovations come from all over the place. And one of the key things we think is really important is to articulate the assumptions behind how this is supposed to work. And what are the bits, the resources, the activities, the things, whatever they are, that help it to work here. And this is a really important process, both for the evaluation, so that we're measuring and assessing the right things, but also for the people within the service to help them understand and share their expectations of what they're doing. And it might come in the form of something like a logic model or an action effect diagram. If you Google each of those, you'll get lots of really great examples. But from an evaluation perspective, it provides a framework then that you can start to identify and locate potential points of data collection. So, like I said before, what are the inputs that are needed to make this innovation work? What are the processes to make this innovation work? And what are the expected outcomes of this innovation? So it helps you map out these different things and the causal relationships between them. So, for example, it might be one innovation is very dependent on a certain staffing configuration, but actually it shows that in certain services where you've got a high turnover of staff, that is impacting upon the processes and the outcomes. So it helps you map the kind of causal effect of different parts of the care system when you do your evaluation. So you're not just saying, yes, it works or it doesn't work, but actually we can explain how it works in this context according to these different factors and the relationships between them. And we often develop our theories of change in close partnership with the people, the innovators in the service, as a part of the co-design process. So it both helps the innovators and the people on the shop floor articulate their assumptions and to be clear about what they think should be happening or what they want to happen. And at the same time, it helps us think about what we can do in terms of the evaluation. Next slide. In practice, how do we go about this? And there's loads of different techniques and ways to do this. But for me, when I do it and I facilitate these workshops when we do it, I often like to, I've called it here reverse logic thinking, but to think backwards. And I'll give an example of this. If you're having your kitchen redesign, for example, you might be asked not where do you want to put the electric power points or where do you want the plumbing to go. You might be asked, what do you want to do in this kitchen? What type of kitchen do you want to have? Is it a kitchen for entertaining friends? Is it a kitchen that brings the outdoor in? Is it a kitchen for family to eat around a big table every day? Is it a kind of semi-professional kitchen because you're a big foodie? And to start with a vision of what you want the kitchen to do. Bear with me, this will work. And then actually you then think, well, thinking backwards, well, if this is the type of kitchen we want, what might be the best layout for this? And where then do we need to put the cooker, the fridge and the plumbing? And then how do we structure the space even more in terms of where the units might go? So to work backwards with what the end or what the end product might be, and then work backwards. So what we would often do is ask our partners and stakeholders to say, well, what would a successful evaluation look like overall? What do you want from this evaluation? Which goes back to the scoping stage. But what is successful from this innovation? What do you think this innovation is really trying to do? If it's trying to reduce admissions, or if it's trying to improve discharge rates, or if it's trying to reduce waiting times, for example, if that's your endpoint, then explain in a backwards fashion how it's going to work, how it's going to deliver that in a step-by-step way. Work almost like backwards logic thinking. And then that then feeds into how we configure the evaluation. So what learning do we need at different points upon that way of thinking? You know, these are the outputs, these are the processes, these are the inputs. How do you then think about translating and communicating the evidence about each of these different bits? What sources of data can we gather from these different time points? And then importantly, from the purpose of evaluation design, what different methodologies or analytical approaches should we use? Next slide, please. In terms of doing the scoping and co-design phase, it involves a whole range of kind of close collaboration and engagement with clients and partners. And these can be difficult because you're almost trying to reach a common understanding of what the purpose of the evaluation is. But often from the perspective of a team that's very close to the innovation or the service, and they've got a real vested interest often in showing that this does work, or they really want it to work, and from evaluators that are typically not as close to the service, that particular service, and are trying to adhere to all of those kind of principles around rigor and design. And so often it's about trying to find a place, a common space where you can have these really productive conversations. And that isn't easy. And that requires patience and facilitation and deliberation and finding kind of a safe space for people to have open conversations. It's really important in doing this often to kind of have an initial sense checking meeting about what people expect from an evaluation, and then to go away and do lots of background research. So when we do ours, we will read, for example, any policies or procedures related to an innovation. If it's based upon a particular set of evidence, we'll look into that evidence. If it's copied from another service, we'll look at how it's developed in that other service. And then we will meet again with our clients and then talk through what we've already found and try and tease out what it is specifically they want to know. And it is this kind of creating this space to co-design the focus of the evaluation and working with people. And again, going away, it might be suggested that we speak to a number of service leaders to deepen our understanding. And so we might do some preliminary scoping interviews. or conversations to help us think about what it is we can do, what sources of data are available, what are the key messages that decision makers need. So we pull all that together, and it is quite a intensive, time intensive and labour intensive process, and part of the process that goes all before the evaluation. So you're investing a lot of time and energy into this setup stage before even actually embarking on the actual tangible bit of the evaluation. Next slide, please. One of the big challenges that is often faced in an evaluation is what you might think is a stop-go or an adaptation decision, because sometimes you might think that an evaluation just isn't feasible, that the innovation or the new way of working is poorly thought through, it's not evidence-based, that you kind of can see that actually there's enough evidence out there to tell you that these, whatever it is, doesn't work, and the evaluation is not feasible. And it's really important to be able to have really frank and clear conversations with partners about what is feasible and what's not feasible. And so it's really clear, it's really important, to use kind of the criteria about things like feasibility, access to data, kind of timing issues to help justify a decision. A lot of the time, we also use a panel of experts, independent experts, that we will run any of our kind of decisions by or thoughts by to justify and help qualify our decisions. But having independent groups there to help you is really important, so that you can go with confidence into a conversation to explain actually what you wanted to do with your evaluation probably isn't feasible. So the option might be to kind of think, well, do something different or do nothing at all. And I suppose that I'm highlighting this because it is a realistic part of the evaluation process, that either it can't be done or you don't want to do it, and so you need to be able to have those conversations, because you don't want to overpromise and then no one's satisfied at the end. Next slide, please. So I'm just going to quickly say that we do this through 3 separate evaluation panels. We have one for PPIE, one for service leaders, and one for methodologists, and we draw upon these to help us, like I say, understand, co-design and sense check our evaluations. Next slide, please. So we then move on to what might be kind of the main bit of the evaluation. We've done loads of time and energy on working out what it is we're trying to evaluate and then configuring the evaluation. And then it moves into the evaluation itself. And again, I'm not going to talk about specific methodological techniques or ways of doing it. I think there's actually a more important set of overarching things that need to be done around project design, governance, data collection a bit, but actually kind of the ongoing things. Next slide. So project management is one of the kind of really important parts of an evaluation, making sure, for example, that you're really clear on the deliverables, on the time, the allocation of resources, having a risk register, thinking about what you might do differently. And I think this is one part of the evaluation agenda that is often overlooked. It's kind of a tacit part of the evaluation space, but it's probably, to my mind, the most important. So it helps coordinate the evaluation work. The next other and really tricky issue in the UK healthcare context is research governance. And I alluded to this at the very beginning, but research and evaluation, or service evaluation, have different requirements under the kind of healthcare regulatory agency standards. So research often has to go through research approvals, and that involves kind of other forms of ethical review and site review. Service evaluations go through a slightly different and a more streamlined process for review. And so it's really important to think very carefully about what types of review your research, or rather your evaluation, might need. And so some of the things that you can do to help facilitate this is, can you identify internal peer reviewers to help you think about the ethical dilemmas or issues? And can you find relevant ethical advisors within your organisation or within the responsible organisation? The point is that just because it's an evaluation does not mean it's completely, doesn't have to be subject to review. It still does. It's just finding the most appropriate types of review is really important. Next slide. Now, I'm not going to go through this, but just to say that basically an evaluation can draw upon basically, the same list, huge list of methods that you use in any other type of research. The key point is that you tailor these methods to answer the key questions. So actually, it's important to have a really good evaluation team that has all these different specialists involved, the methodologists. And if you haven't got them, can you borrow them from other places, or can you collaborate with a university that might have these dedicated specialist skills? So I'm not going to go through all of these, but it's just simply to say that these are some of the ones that we typically use in our work, and we have to draw upon and combine them in different ways. Next slide. So some of the key things that we bear in mind in terms of our rapid qualitative evaluations, and these, I'm just going to talk very briefly about these kind of two issues for rapid qualitative and rapid quantitative, so you can kind of see some broader things. And the first is about kind of, when you're doing qualitative research more quickly, you might need to think about different ways of collecting data. So, for example, you might want to think about using focus groups with representative groups rather than having individual interviews with lots and lots and lots of people. Or if you do want to do interviews, can you make them shorter and more focused? So rather than having lengthy series of questions, but a number of focus questions that you might be able to cover in 10 or 20 minutes even. There's lots of interest at the moment around what we call rapid ethnographies, which is kind of carrying out data collection alongside people who are operationalizing a new way of working or a new technology or whatever the innovation is. And so you can watch it in real time, but you might do this over a very short time period, say a week or maybe a month, rather than a more traditional longer study, which might be several months or years. And the other thing to say that we do with our rapid qualitative evaluations is we try and speed up the analytical process so that we can deliver the answers and evidence more quickly. So, for example, we might not transcribe all our data, all our interview data, or we might use auto transcription. And we might do analysis in group format with using a structured format. So we might have a template or a framework that we use collectively to rapidly analyze the data and populate it. I think the key thing here, it highlights the importance of teamwork and getting different people together with different skills to help you do some of this qualitative work. Next slide, please. There's also the kind of focusing very briefly on the rapid quantitative aspect of evaluation. And here it's really useful to think about routine service data. So rather than trying to recreate or create new sources of data, what data is already in the system you can access? In particular, process and outcome measures that are already in the system. So whatever service it is you're looking at, look at how you can map the existing data onto that theory of change. And that's why that theory of change is really important. And that's the last point on there. And the new series of techniques that we're looking at is around online methods. So using online surveys or kind of, for example, social media as a source of data to understand people's reactions and views about innovations and change in health and care services. But there are risks around, for example, digital disparities. So not all service user groups will have equal access to or familiarity with digital or online methods. Next slide, please. So just generally, I'm going to very quickly talk about some of the general things to consider. Is that basically when we're doing kind of evaluation methods, and we need to think about kind of sampling for the purpose of the piece of research, collecting the right data to answer the questions and not trying to collect loads of data and as much data as possible. You're not going on a fishing expedition. Collect, like this links to that, but very focused data and pragmatic data. So be really precise about what you want to get and how you analyze it so that you can rapidly turn that into the evidence you need to answer those key questions within the time scale. Next slide, please. And I think a key part of the evaluation process from us is around knowledge mobilization, or better, how do other people and stakeholders in the system understand what we're learning, and how can they use that in a rapid way to inform their decision making. So here we emphasize both formative and summative learning. So for example, formative learning is we engage stakeholders and people throughout the life cycle of the evaluation. We don't just have an interim and a final report. We might have regular check-ins, even weekly check-ins, to tell people what we're finding and to share the information. And actually, that information might lead to a change in what they're doing. So we don't have to control for things. We can allow things to evolve as a part of the evaluation. So it involves that close collaboration. So you're in a constant dialogue with your partners and stakeholders. At the same time, we will still have, or want to have, summative learning. So you might want to have a range of different outputs that say, how does this works, how does it work, and why does it work? Next slide, please. And we think this is really important to have what we call multi-method communications or multi-channel. So not just relying upon a report or even a published paper that goes and sits on someone's desk or online, but actually to think much more dynamically about the best ways to communicate with different stakeholders. So with policymakers, it might be a briefing document. It might be a webcast or a blog for certain communities. It might be infographics or videos. It might actually be just going out and speaking to community champions, or community leaders, or community groups to explain to them the importance of what this innovation is and how and why it works. The golden rule is that you have to tailor these communication methods to each individual stakeholder group, and you shouldn't just expect kind of one report to be relevant for all relevant stakeholders. Next slide. And when we're doing the knowledge mobilisation, there's a couple of key things to bear in mind. So obviously you have to highlight the limitations of the evaluation, but also the strengths. You don't want to overinterpret your findings. You want to stick close to the data. You don't oversell the findings. So you don't want people to kind of read into it what isn't there. And you want to always speak to the brief. What were you being asked to evaluate, and stick to answering those questions. Next slide. Just a point here for us in particular at Brace, but I think this is relevant to all research and evaluation, is the importance of attending to equality, diversity and inclusion. And we look at this in a couple of ways. So we ask really critical questions of any innovation or change that we're looking at, in terms of who's benefiting and who's losing from this innovation. Is it fair? Is there a sense of social justice with the innovation? Does it privilege some groups more than others? Does it harm some groups more than others? And so we kind of include an equality assessment in our evaluations. We think that's really important. But to do that effectively, we also do it of ourselves. So we have to keep asking, is the evaluation team appropriately diverse? Are we inclusive? Have we got all the right voices from all the right stakeholders involved in the evaluation team so that we can ask these questions of EDI? So I just wanted to emphasise that point, because it does run throughout everything that we do at Brace, and I think it's really important for all evaluations to bear this in mind. Next slide, please. So concluding thoughts, and then I'll take some questions. I focus primarily on rapid evaluations as an approach to filling time critical knowledge gaps. But I think some of the key things that we've focused on about the importance of being responsive to clients, about being robust, about methodological standards, are relevant to all forms of evaluation. And in particular, the processes of scoping and co-design are really, really integral to all evaluations. And from our perspective, these is where we would really encourage people to focus their energy and their efforts. Thank you. I'm quite happy to take questions now.
Thank you very much, Justin, for a really interesting and informative presentation. Really great. If anyone would like to ask a question, could you either please put your hand up, or I can see we have some things in chat. So I'll have a look to see what we've. So a question for you, Justin, if you don't mind, is you spoke about sort of false starts earlier. And obviously with something that's going to be a rapid sort of review, time is of the essence, but obviously planning is really important. So how do you know you're ready to start evaluating? You know, how do you know you're in a position, because you don't want to make those sort of false starts?
Yeah, that's a really good question. And with all evaluations, it's really important to put that energy into that scoping stage, but you do have to move forward and get on with delivering. And I think we try and do it in our work in a 2 to 3 month window over what we might see as a year to 18-month evaluation. I think you kind of, it's really important to kind of set a schedule of meetings quite early on, and they might be weekly at first with your partners, to really get to grips with what it is you're trying to get to. And so meeting one might be about specifying the focus, meeting and the preliminary questions, meeting two might be about determining the specific questions and outputs, and then meeting three might be the kind of thinking about the methods. But I think, you know, you've got to kind of progressively build this up, and we do it as a kind of living study protocol or evaluation document, and it grows through from each interaction. So it might start off as a 1 or 2 sider, but after about a month it's about 10 slides long and it's really focused on what is deliverable. And so in part it kind of will develop over weeks or months into a clear kind of go, you know, we can switch into the kind of evaluation phase. But in part, we kind of set a rule that we have to go back to the NIHR for our evaluations. So you might set a rule that says we have to go back to the client or the funder within an agreed time period with a worked up proposal. And, you know, I would say, you know, a month to 2 months is a pretty a reasonable window for that. But you have to kind of deliver a kind of fully worked out evaluation protocol so that actually everyone can agree to it. And then everyone's really clear on what the expectations and what the methods will be and what the outputs will be. But you also need that for research governance. So actually, you know, whatever organisation you're in, you will need to have some kind of protocol that says this is what we're doing.
And we've got an interesting question here. It's, what's the difference between an audit and an evaluation? Is it just terminology, or are there actual differences?
That is a good question. And actually, there is a technical answer to this. So an audit is generally when you kind of will assess an activity against an agreed set of standards or requirements. Is it doing what it should be doing? And it might be, it might be process driven, but more often than not, it's outcome driven. Has it done its job? An evaluation is, you could see as a type. I actually use the word, I very rarely use the word audit. I often use appraisal because it's kind of, it's slightly softer in the terminology. But the evaluation might be focused on the expected outcomes, but it will also look for other outcomes. But more than that, it will look for processes and contextual factors that explain what's going on, whereas an audit might not do that. So we often talk about what we call context, mechanism and outcome configuration. So we will measure not just the outcomes and the processes that led to that, but all the things around the whatever the intervention is, that it help explain how it works. So evaluations that we try to do have a much more explanatory power than an audit might do.
Thank you. And another question is, and this is a kind of around about managing expectations as well. It's when someone comes to you wanting an evaluation and they don't really know what they want. What they kind of want is a piece of work saying this is good or positive or it's valuable, but they may not actually know the metrics they're looking for, or the proxy measures, or how do you help people come to that conclusion? And how also do you come across the sort of the fear amongst them that you'll find something they don't want to know? That's sort of two parts.
This is it's a really good question, and it's really, really common. So I'm not saying all the time, but a lot of the time with evaluations, over years of doing it, people often want you to evaluate something that they love or they've invested loads of time and energy in, and they want you to prove it works.
Yeah.
So that's where the rigor and independence is really important, because you've got to be able to say, well, no, sorry, this doesn't quite work how you wanted it to or how you thought it would. A lot of it is in that scoping stage, it is about thinking about articulating that theory of change. So, all the set of assumptions that go underneath an innovation or change process, so that you can be really clear about what they think's going on. And often when we do, for example, workshops with groups, they find these activities really helpful for developing their own understanding and kind of making explicit the tacit assumptions that they held about what they thought they were doing. You can also use them in a diagnostic way because it helps them improve their innovation or their intervention. Because by starting to say this is what we think it's going to do, they realise, well, wait a minute, it can't do these things. So actually, that first stage will actually optimise elements of the thing you're looking at. But more importantly, it will help you identify where the data is available and where it's not available. So if you're wanting to get really good data on some outcomes that there's no way we can get it, then you can sort of say, well, we can't prove that. We can't prove whether this will work or won't work. So what proxies can we use? Or do we need to actually say, we can't do that evaluation? Can we adapt it to look at some other bit of whatever it is you're interested in?
We're getting towards the end of time now. So if anyone has, oh, here we go. We've got another question. So we have to compromise on statistical significance with obtaining quantitative data because of small sample size and evaluations. How else can we obtain rigor? So it's about having small sample sizes and how can, I suppose it's how can we make claims? How do we know we've reached a conclusion where more data wouldn't tell us more or different things?
That's again a really good question. So from a statistical kind of quantitative perspective, it is often the case that it won't have the large sample sizes to afford, the power calculations to afford really, really robust statistical analysis that you might associate, for example, with a trial that's got huge population involved, sample population. So you're right. It might not be able to power very complex statistical analysis of causation or correlation or whatever. And often the statistical analysis is quite descriptive. It's often about describing the who's, the what's, how many, but not being able to kind of make causal inferences. But the rigor does come from the depth of understanding in a lot of our work. So it's not just about does this work, but it might have signals or signs that it seems to be working from a statistical perspective, but actually it's the depth of qualitative rigor, understanding the kind of the local context, the people involved, issues around, for example, about acceptability, fidelity. These are kind of key issues that you can kind of gather through mixed methods, in particular qualitative methods, that kind of enrich the evaluation in ways that gives people kind of that rigor. And obviously, if you're looking about national decision makers, they often do want a really good strong quantitative evidence base and statistical power that shows that this does work. But equally, policymakers tend to make decisions based upon stories about patient X and patient Y. And so actually, providing some descriptive data with rich accounts of what's going on can be very persuasive to certain stakeholders.
Thank you. We're getting towards the end, but do you have time just to answer another question for us, please? Would that be okay?
Yeah, of course. Of course.
So it's, could you say a little more about theory of change and using this as a model for planning the evaluation versus an output from the evaluation?
It's both. I mean, I think this is one of the things I try us to do. So when we use it at the beginning of an evaluation, we will often use it as a kind of guide for planning. So thinking what it is, how you think it's going to work, what we should be analysing, what data we can be gathering. What we often find is that even at that early stage, people will revise their theory of change through having a conversation with us, because we'll be probing some of their assumptions and they'll go, oh, I hadn't thought about that. And so the theory of change will get more and more complex. Through the evaluation, as you start to find out actually what's going on, and yes, looking for the data as expected, but you're often and always really from a qualitative perspective attentive to unanticipated things. What else is going on? And so one of the outputs that we often try to do through an evaluation is to iterate and change or update the theory of change, and actually say, well, based upon what we found, it is working as to a certain extent, it's doing what you wanted it to do, but the mechanisms are slightly different. We've actually found some other factors are at work. And so what you can do from the evaluation is use the theory change at the beginning and then change it again at the end. So you have an adapted theory of change that is now evidence-based according to what the evaluation found.
Brilliant, thank you. And we've also had a request to share your presentation, if that's okay with you.
Perfectly fine.
Thank you. And thank you very much once again, Justin, for a really helpful presentation. And we've got lots of people thanking you as well. So that's been really useful. And thank you. And I'd encourage people to join the other sessions and also read some of your work at the Institute, at the Centre. So thank you. And if no one else has any questions, then we could close the session if that's okay.
Thanks, Rob. Thanks, everyone.
Thank you. Thank you very much.
Thank you.
Everybody,
Bye.
thank you.
Thank you.